We good?
Yes.
Great. Well, let's get started. This session is establishing building partnerships with disability agencies and organizations. And of course, I'm Marty Exline with AT3 Center. And then we also have Carolyn Phillips with Georgia Tools for Life. And this session really kind of builds on the last session on some of the things that were discussed. Some of the things we're going to cover are just what are some of the considerations to determine whether a potential collaboration is right for your program. We want to touch just a little bit on what partnerships and collaborations that state and territory programs currently have or are planning related to COVID, and then what strategies for establishing or advancing partnerships with entities. What are strategies, excuse me, for establishing or advancing partnerships with entities in your state or territory? So just a couple of reminders, of course, to see the captions, click on the captioning button on the control panel. Ask questions or comments in the chat window, and we'll be addressing those at the conclusion toward the end of the session. And then be aware of upcoming events on the at3center.net, of course, events page, or registration links that are sent out on the AT3 listserv. So in terms of, we just wanted to touch on a few things in terms of considering partnerships. Everybody is obviously always doing some kind of ongoing program review, looking for ways to improve your programs. Most AT programs are evolving in some way, whether it be because you have a staff person that's leaving that has a certain area of expertise, or maybe a new staff person coming on board that has some expertise in a certain area. You might change one of your contractors, or maybe one of your contractors leaves for some reason. So it just really depends an awful lot on what your situation is. And of course, there are situations like COVID that arise, which changes the need for the types of partnerships you have. And we hope that that situation doesn't arrive too often, or maybe we're done with that pretty soon. Or maybe there's a natural disaster like a flood or something along those lines that might present an opportunity to establish a partnership with somebody. In terms of identifying a need or opportunity, several of you are doing it right now through your consumer advisory committees, doing some strategic planning. One thing that I would say, and I think you all know this, in terms of being a participant in either some type of advisory council or work groups or committees, and it is tough. I know everybody has a huge workload, but it really can pay off in terms of establishing partnerships. Certainly, I think one area in Missouri, we became aware of a Many Falls a Person stakeholders group. It wasn't even something that we were invited to years ago, but we went ahead, got on the committee, eventually ended up co-chairing the committee, and were able to establish a partnership with our Division of Medical Services on MFP. Another good example, the Maternal and Child Health Agency in Missouri was having annual work groups to determine how their federal maternal and child health funds would be spent. We became involved in that group and ended up with an annual appropriation for our maternal and child health program in Missouri. And that has resulted in, I'm going to say, probably close to $1 million provided for Missouri Assisted Technology to provide funds for children for different types of assisted technology. And then you may get a request from another entity, and certainly that has happened during COVID, whether it be ADRC or some other entities with some of the funds that they've received. And the last thing I want to say is partnerships are on a continuum. There is no right or wrong decision or good or bad in terms of whether, if somebody offers you a partnership, whether you should jump at it and take it right away. There's a lot of considerations in terms of whether a partnership meets your needs, your structure. If somebody's talking about partnering with, say, your device loan program, whether your program is operated centrally or decentralized could have a big impact on the extent to which you want to partner with somebody. Staffing, again, it depends on expertise and the time that your staff has available for it. Some of you have very small staffs, others have some larger staffs. And your current relationships with an entity. If you have a close relationship with somebody and have been involved with other projects, you have a lot better opportunity to establish something that works for both partners. And then sustainability issues. I think that's certainly a question with some of the COVID funds. If something's available and you're able to establish something for a year, looking down the road, what's going to happen in future years? So that's something to take obviously into consideration. And just in terms of COVID-19 partnerships, we'll have certainly some information coming out when we do our COVID-19 report from our most recent survey, but just to kind of overview some of the responses in terms of partnerships that the state AT programs and territories have built. As far as aging and disability resource centers or No Wrong Door, there's about 81% of the respondents said that they have a partnership or are planning one. Centers for Independent Living, so many of you already have partnerships with your CILs. 72% said that they have partnerships or are considering one. State education, 66% had some type of COVID partnership or were planning one. The same for state vocational rehabilitation programs. Faith-based partnerships. There were a number of states, about 39%, that said they were either had some type of faith-based partnership or were establishing one. And then don't forget about developmental disabilities. There's a lot of states that have established partnerships either related to COVID or even before that with their developmental disability councils or their state developmental disability units. And in terms of COVID-19 activities, I mean, they were all over the board. A lot of them related to device loan or other AT distribution with distributing especially tablets or other devices. We heard about Idaho's, obviously, Virginia, Illinois, Wyoming, Connecticut, North Dakota, a lot of states and territories. Provision of AT kits, we heard a little bit about that in the last presentation. A ton of training and technical assistance during COVID. Everything from monthly webinar series to Technology Tuesdays. A couple of programs were having weekly meetings or bi-weekly meetings, not with any specific topic in mind, but simply to talk about whatever was on the mind of the people that attended that Zoom meeting. People participating in a variety of aging-related committees, providing training and technical assistance on tablet devices related to ADRC funding, working with our state workforce commission to provide ongoing training and TAs, same with state educational departments, consultations and assessments, lots of demonstrations for vocational rehabilitation and even some local school districts, support for parents and grandparents on using tablets for distance learning, technical assistance to behavioral health entities for support on telehealth services was another example. Consultations to provide appropriate assistive technology, again, for social isolation. A couple of you are working with vaccine or testing sites related to accessibility. And then another one was working on a project provide AT to childcare providers. So it's just a wide variety of different projects depending on what's the best fit for your particular state and your particular assistive technology program. And with that, I'm going to go ahead and turn it over to you, Carolyn, to talk a little bit more about considerations in working with partnerships.
Absolutely. Thank you, Marty, for inviting me to do this with you. And hello, everybody. I have missed y'all more than I can express. I remember when we were together last year in DC, and Alan, hearing you talk about what was going on in your state. And I remember thinking, oh, poor Alan, and goodness. So we are definitely all in this together. And I do hope all of you are safe. And so thank you very much for this opportunity. Honestly, a lot of what I'm going to be talking about with you, I have learned from a lot of you. I remember in 1996 was my first meeting of the AT Act, being involved. And I was sitting near at the same table with Sarah Sack. And Sarah, you were talking all about the importance of relationships and how relationship driven Kansas is. And I remember thinking, I want to be like that. And that definitely has framed the way that I have approached this whole journey within Georgia. And so the first piece that I was going to address here, what are some of the considerations to determine whether a potential collaboration is right for your program? And I think that's right. Y'all may have seen me smile a little bit when Marty was saying, that, all partnerships, some are good, what have you. There have been some bad partnerships that we have had where I was like, uh-oh, that was not such a great idea. And so anything I can impart in how to amplify the great ones and then also kind of spot the ones that you might want to avoid or nurture, definitely happy to share. So we'll move to the next slide. And here are just some of the thoughts that I have. And often when we bring somebody onto our team, one of the things that we often teach, it's all about building relationships. And Marty, did that slide move?
Sorry about that.
I just want to make sure that everybody's seeing what I'm talking about or where I'm talking from.
This is slide you.
Yeah, and we can move, to the next one. And I can just keep talking. So when I'm thinking about partnerships and we're trying to grow those, when we first have people come onto our team, it's one of the first things that we start teaching is, and it's one of the things we look for in interviews too of new team members, is the importance of being able to connect, being able to think about partnerships and be able to grow partnerships. One of the things that is primary in our mind is how is this relationship, or how can this relationship help our state, help if you're in a territory, help your territory, increase access to and acquisition of assistive technology. And so that's one of the driving components. I love the piece in our legislation that is about leveraging. That was brilliant. All of you who worked on the original AT Act and then all the amendments, keeping that in is extremely important because it definitely motivates, I think, all of us to think immediately about what are the relationships that I can leverage. And Marty, did it move?
Carolyn, I'm going to ask Dave to share his screen because it seems to be like that.
No worries. And I'm just going to keep going in the interest of time. And so Dave, just so you know, I'm on slide 10. And so leverage. That's what I would encourage folks to think about. Is what is the win? I also often think about win-win-win. Where is the win for us? Where's the win for our partner? And where's the win for the folks we're trying to serve? It should be. I believe we're collectively brilliant. A lot of you have heard me say that, and I absolutely believe that. And so a lot of that is, I think, up to us. And how can we really help figure out what it is our states need, the folks within our states, and really thinking about strategy. I remember my dad taking me to play pool. He was an aerospace engineering guy, and he loved to play pool. And he was always talking about, it's not the first shot. It's not the shot that's right at hand. It's the shot that's 3 or 4 down that you're really planning for. And I would say that's very true for partnerships. There are times when I'm in a initial meeting with somebody, and I'm thinking, this could be, a great, and thinking about all the different ways we can do this, maybe 2 and 3 months down the road or years down the road? Or what is, just thinking not just the first relationship or the first shot, but what are the other ones? Also considering mission. There are a lot of folks that come to us and they're like, oh, y'all do such a great job doing X. And it's not necessarily what they want us to do that's within our mission. And so making sure that we avoid mission creep, it's easy to get into that space, and working very much within mission. And sometimes it's us pulling people back to our mission. Once again, one of the beautiful things about the Assistive Technology Act is that it allows us to serve all ages, all disabilities. Not everybody has that kind of flexibility, but that allows for all kinds of space for creativity, and a lot that can fit within our mission, which is great. With every single partnership, I always think about sustainability. So if we're creating something, how are we really going to sustain that? If we are, developing, maybe learning like modules together, how are we going to actually keep those going and growing? And so always thinking about sustainability, and that strategic planning, really creating a partnership plan. We have a partnership plan that we started, 20 years ago, where we have mapped who our partners are. I'm going to show you a little bit of that in a minute. But also thinking not just this first year, not just 3 years, but 5 years, what have you down the road. One of the great things about COVID, in my opinion, is that there are a lot of folks that for years we across the country and in the territories have been knocking on doors and wanting to partner with people. And I think finally folks are saying, oh gosh, that's a great idea. I have had people that literally I had been trying to work on a partnership with for 10 years, that finally turned around and they said, maybe we should partner. And I'm like, yeah, we should do that. So I have a quote up here and it says, if you fail to plan, you are planning to fail. Benjamin Franklin said that, and it's definitely true. And I have thought about that a lot. And so shout out to Kim and Sandy. Benjamin Franklin's right on. So, and we'll move to the next piece. So synergy is a lot of what I'm going to be talking about. I'm a big reader, for those of you who know me well, even though I'm incredibly dyslexic. And so I'll refer to several books, but 7 Habits, it's actually 8 Habits now, but Stephen Covey's work on 7 Habits. This habit number 2, which is really beginning with the end in mind, is thinking about that priority system. What is it that our program needs? What is it that that partnership potentially has? Going back to Sarah, I remember, Sarah, you reaching way outside the box and talking to funeral home directors when it came to reuse. That was brilliant. And sure enough, paid off. Barclay, some of those relationships that you've talked about and some of the ways that you've leveraged and connected within your state. Same thing, Oklahoma. Good Lord, I actually showed up in Oklahoma to get Linda to teach me some of her philosophies about growing programs, including her reuse program and AFP, alternative financing. So thinking about that plan and that whole saying no for the greater yes. There are a lot of opportunities that we turn away because we do need that greater yes. And so thinking about that. Developing that partnership plan and working the plan, not just having a partnership plan, but actually working the plan is very important. And, I've learned this from a lot of y'all. It's also important to make it fun. You want to have a good time with your partners, and you want it to be something that I think especially now exponentially grows and can be transformationally, in its impact in the lives of folks. So thinking about that. Whenever I'm working with partners, we go ahead and talk at the very beginning about what does success really look like in this partnership. So whether it's with our Department of Education, I can come in with assumptions of what I think they think is success, but unless I hear it back from them, or at least we have that intentional dialogue about success, then what are we really going to be evaluating? How will we know we're successful? And I have found that, that's one of those critical things. And also success breeds success. I was on a call this morning with our Division of Aging Services. They have more CARES Act funds. They tried to get them to another partner, and they were just struggling with that. But they said, you know what, Carolyn, we know you'll be able to spend them correctly, and we'll also be able to be successful with this. And I was like, bring it, that's great. So let's make it happen. But it goes back to us having a common language about what success is, having that intentional conversation, being able to evaluate and evolve, that, and very important. Another thing that I have learned even recently, a lot of times what I see are programs that are just maintaining. And within our world, in my opinion, within the AT Act, we have a growth management mindset. It is about growth, and it is focusing on results and on those relationships. And that all goes back, as I said, to synergizing. So we'll move to the next slide. So when I'm talking about synergy, and I often explain this to folks, what I'm often looking at is that interaction, usually between two or more, organizations, agencies, what have you. It's interesting because the relationship I was just telling you about with Department of Education, our vocational rehabilitation agency has now wanted to join in, right? Because there's a lot of synergy there. And sure enough, I think that is going to be a game changer for us. And so basically what happens is these partnerships, this synergy, we produce a combined effect greater than the sum of our separate efforts. And that's absolutely true and very much what's happening. The other thing, and I know a lot of our partners who are within university systems, often at Georgia Tech, we are measured by what's our impact in research. So I'm often having to look at research and how that synergy flows with practice and services, our direct services, which flows also with our education, which is our training, public awareness, all of that, which also flows into policy. And there's intermixing between all of that. So a lot of times the partnership may be a very specific partnership that I'm looking for. It could be, I am only looking for this partnership right now, specifically when it comes to public awareness, or specifically when it comes to serving a specific group of folks within our community. I remember Roger Levy telling me years ago in Texas, and Angela, I stole y'all's model of partnerships, because he was saying, oh, there are times because the state's so big that I have to go to very specific folks with a specific goal of that partnership. And sure enough, that has worked for us. So I'll move to the next slide. So when we're talking about partnerships, success really is linked to that ability to synergize, as I said. I do think that also valuing differences, a lot of times our partners are coming to us and they're coming really because they have a different win that they need, a different way that they're measuring success or what have you. And so often what we're doing is we respect that, and then we build on that strength, if you will. There's also folks that come and yeah, they may have some weak spots. We have weak spots too. And so figuring out how we can merge and come through that to be stronger together. I think it's also important to realize that even as individuals, we have different paradigms. We do see the world differently. We're working very closely with our folks here at the Centers for Disease Control in Atlanta. That was not a relationship I had anticipated growing the way it has. We had done a lot of things like employment, awareness day or disability awareness day, or, did little speeches and they would come visit us and what have you. As soon as COVID happened though, boom, it really grew really quickly. And so one of our partners here in Atlanta, who a very small group that is working within the deaf community, they were wanting to get connected with the CDC for years. And we knew that they had some weak spots. We also, as I said, everybody's got weaknesses, everybody has strengths, but we were able to actually help them build up in a way. So now they're really helping in a huge way with that partnership. So once again, it's a three-way, three-spoked partnership, and definitely helping us. We're getting the win we need. They're getting the win they need. And also the CDC is getting the win they need. And we'll move to the next slide. So next question that we want to think about is, and I'm going to have to go back and look at my question. Sorry, because you went so fast. Usually I'm not reading these. I just identify it because I listen to it ahead of time. So what partnerships and collaborations do state and territory ATAC programs currently have that are planning are planning related to COVID? And we'll move to the next slide. Thank you, David. That was very kind. So here's an example. One of the things that we do that we, it's one of the activities that we do within the AT Act is the technical assistance, right? So we have for years been hosting our advisory council. We've been hosting even some of our conferences. We've always had this kind of virtual edge to it. We've always had that way because we've been ever mindful, and Liz Prasad is the one to thank for this. She's said not everybody's going to be able to show up. We have any number of reasons why, and it could be an autoimmune issue, it could be any number of things. So long before COVID showed up, we have been providing this virtual programming, including all the webinars, but even ways to handle organizing meetings on site, but also with this virtual aspect. Georgia Department of Ed, Georgia VR, and the Division of Aging Services all came knocking and asking us early on in the COVID crisis, how do you do that? How do you transfer person to person, in-person tours, conferences to a virtual platform? So we have been able to show that. Actually, kudos to a lot of you. I've participated in a lot of your events to learn even more. And even this meeting today, it's been a lot of fun. I see a lot going on about bingo. I've never done the bingo thing, but that sounds like fun and good luck. I hope y'all get bingo with something that I said in this presentation. Or I could read the list if somebody wants to tell me what the list is. but the thing is that, just making it fun, but also accessible. That's one of the keys. And always thinking about inclusive design. So once again, that's one of the ways we have been able to leverage. We ended up with little contracts with all of those partners there, just helping them with virtual programming, and those have continued to grow. And once again, it was about being positioned. Our angle is the accessibility piece, and it's also looking at the assistive technology piece. So what we have found is that we are interacting with people, whole different departments within these partnerships than we ever have before, which has also helped with our ICT goals. And we'll move to the next. Another example that we have is in good job to North Dakota, Idaho, Virginia. Those are great presentations. I took a bunch of mental notes, and our team will be definitely listening to the presentation again. And I've reached out to all of you about these, all three of y'all about this in particular. So our demos and lending library. Once again, being able to expand that, and that happened through COVID, primarily because of the CARES Act for us. But it also was a relationship that we started literally like 10, I would say 20 years ago, we started having them on our advisory council. 10 years ago, it started having a tiny, tiny little contract, and didn't really know if it was going to grow or go anywhere. And we were just positioned. It was having that consistent conversation. It's showing up at their meetings. It's showing up their events. It's inviting them to our meetings, inviting them to our events, writing them into, grant opportunities. and having those deeper relationships and being ready to say yes when the opportunity came. So when the opportunity came, when CARES Act money came out, and Audrey, we were on that call, and Rob and a bunch of other folks had let us know this was happening. It wasn't my first introduction to the director of Division of Aging Services. I was actually texting our director, Abby Cox, and she was texting me right back because we both knew we need each other. So it was great to not have that cold introduction. Now, truthfully, the way I met Abby was, you know, I went to one of her presentations on purpose to meet her when she looked like somebody who was really going to be a game changer in Georgia. And sure enough, she has been. She's definitely one of those bipartisan folks and an excellent friend to the AT community, but also has a bigger vision for Georgia when it comes to aging and folks with developmental disabilities. So go with intention, you know, meet folks, you know, and once again, that strategic planning, thinking about that partnership plan. So we'll move to the next slide. And I hope this is interesting to y'all. I do appreciate that y'all are listening. So and we'll move to the next. You just hit it again, sorry. So another thing, because of our commitment to universal design for learning and really having this bent towards being as inclusive as possible, we have been producing videos for years. What we found is that a lot of times we were just producing the videos for our own, you know, folks within Georgia. With the Pass It On Center, a lot of you participated in those videos. The videos do make a difference. I think it goes back to our commitment collectively across the country within the ATAC community of being able to have that bimodal input or see it, hear it kind of thing, and, you know, actually you know, have the universal design for learning, multiple ways of expression, all of that. So Georgia Department of Education and GVRA, they, whenever things changed for them within COVID, a lot of their work changed. And so they were like, oh, hey, you know, do you have any ideas of what we could do together or what else we could do together during this time? And I said, sure, you know, what about making some of these videos about assistive technology? We know that folks need these. What would that look like? And so sure enough, we have a partnership where we are creating customized assistive technology training videos. We're now talking about creating a massive open online course together or some type of certification together. I'm actually going to be reaching out to several of you about that. I have Therese and several other folks on my list, and Janice, where we definitely want to talk about this. But it's exciting, once again, to be ready with something that actually is a win-win-win, something we're already doing, and now we're getting paid to do, and it's actually, once again, sum is greater than its parts. So, and we'll move to the next. Another example is all the webinars. Thank you, Alan, and our WATAP partners. Our Tools for Life team was, they were just like, you know, kind of tired of doing their own webinars all the time. They wanted to spice it up. And so we actually got together with Alan and his team and came up with Wired Wednesdays. And Carol Page, I know you have Tech Tuesdays, I think, and Kim, you have also maybe Tech Tuesdays also. You have, we love those ideas that we heard from you, and what we try to do is customize it. These are like 30-minute sessions, so they're digestible, they're easy, and they're a lot of fun. It's great to work with our partners on something like this. And then also had little contracts that are continuing to grow with the Division of Aging Services, vocational rehabilitation, and keep in mind that once again, it's leveraging what we've already got and what folks are doing well. A lot of you, oh my gosh, your webinars are outstanding. I come and listen to yours in our trainings for our team. some of your webinars are what I'm like, okay, this is part of your onboarding, is to go listen to our partners around the country who are experts. And so, you know, ways that you can leverage, get paid for this, and then have that win-win-win situation. The CDC, that was not in our original agreement. They have now contracted with us for, I think it's about 7 more webinars. And so just thinking about that strategically, and how can we stretch the dollars as much as we can, and make those relationships grow. And so we'll move to the next slide. So we have a lot of different ways, Georgia, that we're thinking about success. And I am, like a lot of you, concerned about all the folks within our state and within our territories that do not have access. We have, believe it or not, a lot of white spaces, spaces that are in rural areas in Georgia. I always feel silly talking with y'all across the country about this, because I know some of your states are so much bigger, you would gobble up Georgia in one bite. And but Georgia is the largest state east of the Mississippi, which I know doesn't say a bunch. But the thing is that we intentionally are looking at our white spaces, and we're trying to figure out where the gaps are. And this is the other piece to partnerships and our strategy is we have very intentional partnerships within a lot of the white spaces, where we are purposefully saying, okay, so what does this look like in rural Georgia if we can get internet access to them? And so what we have been doing is talking with our governor's office, but also talking with our Comcast and trying to get them involved even more, so that we can actually get assistive technology in a meaningful way to folks. So this is one of our stretch goals. And so I encourage y'all to have stretch partnerships, ones that, you know, you really go after, that you'll get really excited if it works out. And this is one of those. So stay tuned. But this is actually hitting partnerships in that very uncoupled way. It's really pulling together different relationships, and who knows if it's really going to work. We'll see. So we'll move to the next. So we also are, like a lot of you, holding people accountable for accessibility. You know, I was talking to Rob Carr about this not long ago. The importance of going beyond accessibility guidelines. When people tell me that they're ADA compliant, I'm like, no. You know, I was, you know, in a meeting, this was about a year ago, and I just, you know, it was a big meeting with a bunch of other folks, partners, potential partners. And usually when people are like talking about the ADA and they're all excited because they're ADA compliant, I don't always hold people accountable. But a year ago, I was like, it's not good enough. And then I just totally told them what was on my mind and in my heart about building for the future. This next generation, the ADA generation, is not going to put up with this ADA compliant thing anymore. We've got a whole group of folks who are students who are IDEA students. As you know, I live with 2 of them, and they just don't accept things not being completely accessible. They are absolutely looking for the captioning. They are absolutely looking for things to be read out loud. And they just don't have a lot of tolerance for, you know, this low level of accessibility. So pushing folks to go beyond accessibility guidelines, to go beyond accessibility compliance, you know, working with CAST, you know, and thinking kind of bigger about what can this really look like. And so that's been one of the great things also with some of our partnerships. And I encourage you to think about that too, is how can you leverage some of those? How can you push them a little bit more? What can you bring to the table that actually raises all of that to a whole different level? So, and we'll move to the next. One of those, as pretty much, as I said, as soon as COVID happened, a lot of you actually reached out to me and they're like, hey, isn't the CDC in Atlanta? And I was like, yes, it is. And I actually know a lot of these folks. And that was one of the relationships where we definitely, I think, want to think about like a lot of folks, think about how can we help even more, especially when it comes to accessibility of public health information, and during this time, what does it look like for the built environment and virtual environment? I'm so proud and so happy of so many of you are also doing this with your public health departments, and that you're at the table and that you're developing those relationships. If you haven't knocked on those doors, I encourage you to knock on them now, and happy to share anything we have that could help you get your foot firmly into that door and a seat at the table, so that you can have those conversations. I know Christina, y'all have done a great job in California, and I've been watching what you're doing and actually have grabbed some of what you've done to try to make that even bigger here in Georgia when it comes to public health. And thinking about that we absolutely have a place in that conversation. A lot of the relationships that I think have those bigger impacts. We may not get the total credit for what we're doing with them, but any way that we can help a website be more accessible, any way we can help an app be more accessible, even if it's getting people to help test, do UX, user experience testing, finding, folks to participate in that. That's something we can contribute as people who are connected within the ATAC community. And so, thinking kind of bigger about what those relationships could be. Once again, what is it that our state needs? What is it, our territories need? What is it that we need as people with disabilities? And what is it that our partnerships within the ATAC community, how we can really leverage to make that happen, for not just the short win, but the big win, that's that sustainable win. And we'll move to the next slide. So, and same thing, also sometimes offering, what we have, and then being able to amplify that. I was talking with some partners within the public health, and they didn't have their materials in accessible formats, and they sure didn't have an accessible website at the time. And so we said, okay, well, we'll help host that. And we did that at no cost. And sure enough, it has led to these bigger relationships. So think about what it is you have to offer. You have a lot of expertise. Your team also can have a lot of expertise that a lot of people are not aware of. And sometimes it is putting that piece out before, hey, here's a little something that we can offer, and then seeing how it can grow. And we'll move to the next slide. And this is just an example of how we did offer that. And then now you'll see that a lot of folks are starting to adopt, and we're really collectively trying to push the message for easy to read, making people aware that everybody doesn't necessarily use the same way of accessing websites. We don't all read at the same level. So it's also about raising awareness to our partners on multiple levels. And so trying to make sure that everybody understands that, once again, it is about what it is that our folks need. So, and we'll move to the next slide. All right, so establishing, that's what we're going to be thinking about, or advancing. So what are some of those strategies for establishing or advancing partnerships with entities in your state or territory? We'll move to the next slide. So as I've said, mapping is one of the big things that we have done when it comes specifically to our partnerships. And so we have mapped specific activities, and we actually have a document that shows this. So our AT demonstration, and what are all the different relationships that we have now and that we would like to have. And that could be across categories of like education, workplace, community, ICT, or it could also be, as I said, like within a specific county that's maybe struggling. It could be within a specific community of users, like AAC users who might have ALS. And so how can we partner and help with that very specific activity? So AT activities, that are within the AT Act, within what we're called to do. Alternative financing, the loan activities when it comes to loan libraries, the AT training, and I just showed some examples. We really had not been paid much for our training activities in the past, and so we're thrilled that as a result of COVID, boom, here we are now, which is great. And how can we sustain that? AT reuse, and then of course ICT accessibility. That's another one that during this time of COVID that has gone through the roof as far as partnerships. So leverage those, and it's not too late to get to know folks. And so very important. Then mapping the fields and areas. This, once again, it's some people are thinking, they're not necessarily thinking about assistive technology, but they may be thinking about accessibility or AT in emergencies, right? They may be thinking about a very specific thing. They may be thinking about faith-based and accessibility. We have a lot of synagogues, mosques, churches, even a Buddhist temple that has reached out to us during COVID because they want to, and they are now, making their services more accessible, which is great in that virtual space. And so it's been great to be able to leverage that. Mapping communities is another way. So we have these layered on top of each other, if you will. So that could be some of the big ones that we're all familiar with, K-12, post-secondary, workplace, our VR offices, obviously, and VR agencies. It could be obviously community, and what that looks like to everybody is a little different. Our Division of Aging Services, developmental disabilities, what have you, specific disabilities. But also, thinking a little, once again, stretching this. So we actually have intentionally started working with our historically Black institutions. We are very, very honored to have Spelman and Morehouse right in our backyard. And those are relationships that we are intentionally growing. Black lives absolutely do matter, and we are absolutely working on this together. Also our LGBTQIA community, and really focused on that. So, and then mapping viewpoints. So what are the perspectives? People with disabilities, circles of support, educators, engineers, administrators, procurement folks, sponsors, developers, industry. And then mapping all of that, laying all of that out, and then being intentionally setting goals as to where do we want to be in 1 year, 5 year, 10 year, what have you. And we'll move to the next. I think we'll move to the next. Oh, there we go. Okay. So I've got an image up here that is actually, it's the hedgehog concept. Jim Collins actually created this. And so really this is about, it's about partnerships, building upon the synergies, building synergies. And there are some questions in here. And those are some of the guiding questions, guiding principles of our partnerships. So big thing first, right, is listen to your partners. So seek first to understand and then to be understood. Spending that intentional time together, like I was telling you, showing up, whether it's even online, showing up, planning, those types of things. Starting with very small projects, and I've already shared this, success breeds success, but getting those small wins and then growing those wins into bigger wins. And then what I would encourage you to do, and I do this with our team about once a year where we think about this. And then when we're meeting with partners, we think about that too. So the first one is about exploring. So what is it that we are deeply passionate about? What do we want that end result to be? Our team is passionate about a lot of things. Assistive technology is key to that passion. It is a unifier. So what is it that we're passionate about? Now, I got to tell you that our folks at the Buddhist temple were not passionate about assistive technology, but what they were passionate about is getting everybody online. And some of those folks had disabilities, and we were able to get assistive technology to some of those folks, and that's great. So that was a shared passion. So what are they passionate about? What are we passionate about? So that's the explore. Then dream, right? What can we be the best at? Like, how can we really do something together as we're thinking about our mutual skills, our mutual experiences, mutual resources? Sometimes what we're bringing is a good idea and somebody else is bringing funding, which is great. Sometimes we're bringing some experience and somebody else is bringing a connection, right? So thinking about that. And what can our talents contribute? So thinking about leveraging, once again, we don't have a ton of money within the AT Act, but goodness, we know how to leverage and we are full of talent, which is great. And then that sustainability piece, what's going to drive that economic engine? So planning every single step with sustainability. And what we're always looking for is that sweet spot. So there's blue circles, 3 blue circles, and then there's a little orange spot that's actually where all of those converge. And I'm sure this is actually called something that y'all know the name of. But anyway, so the sweet spot is what I'm going to call it. And that's what I would encourage y'all to think about. And as we're thinking about partnerships, I will also say that this conversation about partnerships, it's ever evolving. You know, the way that I look about partnerships, the way I get excited about it, it is ever growing, ever evolving. So, and we'll move to the next slide. So building skills. There are times, and actually, Linda, I learned this in a conversation that you and Amy and Sarah and I were having, and it really came down to thinking proactively about building skills so that our team is ready for those partnerships. And so focusing on preserving and enhancing our greatest asset, which are the people, right, that we have on our teams. So my commitment really is to invest in our team so that we'll be ready for those partnerships, staying up to date on what's coming next with WCAG 3.0, staying up to date on what AT is coming out, knowing what platforms you know, are more accessible, and those are changing every day. So thinking about all of these different aspects. So having that time, carving that time so that our team really does have the skills and knowledge and experience when we get into the relationship, that we're there and we're ready. So commit, learn, grow, act, do is what I think about. So, and we'll move to the next slide. Oh, there. So when you're making that partnership plan and you're working the plan, the other thing that I'd want you to think about as I'm wrapping up is think about, and I think about this in kind of a way of, you know, if I'm going to have a partnership that's first starting out, then I'm really just planting seeds. And so just to see kind of where this partnership will go, I, you know, make sure that I have partnerships at all of these levels, by the way. So I've got some that I'm planting seeds. That's 0 to 12 months where we should see kind of what happens. I have some that I'm nurturing. So it's 1 to 3 year where I'm seeing that kind of nurturing going. Some where I'm actively growing, and that could be 1, but definitely to 5 years where we're growing this relationship and then sustaining that. And we do have like 25-year relationships, which is exciting. And so, you know, thinking about it from that perspective. And then just as I'm wrapping up my thoughts with y'all, just thinking about win-win-win. Stephen Covey taught us that years ago, and it's absolutely true. So what's going to work for your state and territory? What's going to work for your program? What's going to work for the people? What's going to work for your partners? All of that. Everybody wins. Diversify the funding. That leverage piece is so beautiful in our AT Act. You know, relationships, be relationship driven. It's intentional, and be that, you know, and really think about that. Tracking trends. I'm often picking up the phone and getting in touch with some of y'all so that I can know what's going on in your state, because you might have a trend that I want to build on. And sure enough, that happens a lot. I often start things as a pilot in case it epically fails. And then I also make sure that I say, and I do believe this, that there is dignity in failure. So some of your relationships or partnerships, the projects you're working on may fail, and that, you know, lessons learned. But that doesn't mean that you should give up. maybe just look at it a different way. And always give your partner credit. Once again, Sarah, I remember you talking years ago about nominating your partners for different awards. I now do that. And sure enough, it pays off. It pays off. And they deserve the credit. They deserve those awards. And it makes them lifelong partners, which is great. And then share within our ATAC community, just like we're doing today and yesterday and tomorrow. Because we really are stronger together. And I once again encourage you during this time of COVID when so much is so stressful, let's just make it fun and keep focusing on all of those things. So, and we'll move to the next slide. All right, questions. I hope this was interesting and helpful. So what questions do you have?
It was great, Carolyn. I'm so happy that you really emphasize planning, because I think a lot of times, you know, partnerships just happen, and they do just happen sometimes, but the planning part is so important. And I love the idea of you going up to somebody, attending a presentation just because you want to meet a person and just establish that relationship.
Well, that's how it happened with us, Marty.
Yeah, that's right.
That's right. So, but thank you for that feedback.
Melinda just has a comment. She just said the fiscal component of partnerships is super important. Talking about they met with an organization, was interested in having them take over the AT program that they ran. Everything matched in terms of goals, mission, etc. They were all working with a few of New York's outreach centers. But when they really looked at it, there just was going to be a lot more staff time that was involved, and actually, you know, funding that the actual trade program would have to take on. So that's just important to look at to make sure it fits with your fiscal abilities.
That is a great point. Yes.
And any other questions that people want to put in the chat room?
Surely y'all have questions. You may have questions about bingo, which I don't know how to answer those, but.
Well, there were a few bingo chats during the presentation.
Okay. So. I hope I gave you some words. I don't know.
Everybody, some comments, great tips and ideas. So.
Oh, thank you.
Great job. Lots of compliments.
Thank you all.
I think that's about it as far as questions.
Well, how about that?
So you must do everything that anybody would need. So that's good.
Or we're just amongst a bunch of pros, which is very true. So,
well, thank you. One new question. There, from Kimberly Mills.
And can someone read it to me? I can't read. Can't read that. Sorry.
Yeah, and I'm not seeing it. Can you read it?
Okay, I'll read it. What are some exciting partnerships you are developing surrounding HBCUs and LGBT partnerships?
Great. Okay, so what we have been doing is working with disability student service providers at the HBCUs. And what we're finding is that actually they are communicating even more. So we have assistive technology that folks can use like via the cloud, and then also have entered an agreement with them so that we're doing very focused trainings on assistive technology for their students with learning disabilities. A lot of folks and so it's more that intentional dialogue, if you will, an intentional effort. We have one of our labs that is starting up, going to be starting up with one of the HBCUs. That's why I usually say historically Black college and university, but where we actually have a lab that's going to be starting. And then we're also doing some cool things where we're talking about internships, specifically with our program, so that we can get more folks in the field, which I would love to see. When it comes to our LGBTQ community, what we have been doing, once again, is more that intentional dialogue and having, a lot of conversations with folks, and just being very focused on the relationship. So there's a youth pride, and a lot of those folks actually, there were several folks that had never been diagnosed with learning disabilities, but yet they struggled through school, and they were really more focused on, being marginalized, and some of them actually just felt like they were not smart. Two of them actually did go on and get evaluated, and they have learning disabilities, and so now we're helping them with assistive technology. So it's really kind of that hanging out with intent, and letting them know that our program is here to serve everybody. And sometimes it takes us reaching out directly. So I hope that answers your question, Dr. Mills. And hey, Kimberly.
Any other questions?
I'm sorry, Marty, to interrupt. There's a question from Sandra about questions in Whova. You can post questions in the Q&A at any time, and we will monitor those and answer those if you think of something else later.
Well, thank y'all. Stay safe, everybody.
And before we go to answer any bingo questions, the rule is blackout. We are playing to blackout. I have given you 52 words, so I'm hopeful that somebody is close. And if you have any questions, just message me and I will be happy to answer them.
Bingo. No, I didn't get bingo.
Well, if there isn't anything else, I'm going to turn it back over to Dave for our daily wrap up.
Thank you, everybody, for participating in today's panel presentations, and we hope you gathered a whole lot of great information. I know we covered a lot of topics today. In our earlier panel, you heard a lot of information about devices and working with ADRCs and AAAs. A lot of discussion about social isolation. We've talked a lot about how to do device demonstrations and various partnerships this afternoon, from the community to your SDA partnerships and all those community-based activities that you're doing. We had some interesting overviews and comments about the use of iPads and limited broadband access. A lot of people are doing things that they hadn't thought of doing before, new trainings, especially videos that they're posting to YouTube. Our AT3 is working on a series of issue briefs, and I know many of you are creating fact sheets. There's just so much going on, and it's so wonderful to see all that's being done. So we hope you've had a great day, and tomorrow we're going to begin again at 11:30 a.m. Eastern time with where our One Big Thing videos will be continuing to be posted. And then at noon Eastern time, we will also have our introduction to the day and our Let's Get Started activity for tomorrow. The biggest part of tomorrow we've spent in affinity groups, and we'll be discussing a wide variety of topics that have been brought up through the course of the first 2 days, and some other topics that we know that you'll also be interested in sharing from your programs what's going on. So I thank you all. I hope you have a wonderful evening, and we look forward to seeing you tomorrow.